This study was designed to really test the question around the integration of cetuximab with two different chemotherapy radiation platforms, and ask the question, is one platform better than the other? The two platforms were the so-called FHX regimen that is developed by the University of Chicago and used there, and the other was a more standard cisplatin radiation approach with accelerated radiation developed by the RTOG. Siltuximab was also used as induction chemotherapy combined with carboplatin and paclitaxel. So every patient had that induction chemotherapy triplet, a triplet that incidentally showed very high activity in a prior phase 2 study. And then patients were randomized to receive either the Siltuximab FHX regimen or the Siltuximab platinum radiation regimen. And again, the primary endpoint was progression-free survival, asking the question, is there a regimen that makes sense to take forward? The main results of the study showed that, in fact, both regimens appeared to be equally effective and produced some pretty good progression-free survival results, and those data have been presented and are about to be published. But what we looked at when we began to analyze the data was obviously HPV status, and what we noticed was the HPV negative patients did actually remarkably well, especially on the FHX regimen. So in other words, patients that were HPV negative, treated with this induction chemotherapy triplet of cetuximab, carboplatin, paclitaxel, followed by cetuximab's 5-FU hydroxyurea radiation, the FHX regimen, had progression-free survivals and overall survivals markedly higher than we would expect in a historical HPV negative cohort, even compared to our own historical data at the University of Chicago, suggesting that there may be something to the addition of cetuximab, especially in the HPV negative patients. And of course, that underscores some of the data that we're seeing with other studies, such as the afatinib trials.